What brings you to my chair?
It is time for talks.
It's talks time. Okay. What did you think about the last time you had your talks?
I felt like it was good. I liked where you put the placement, but I feel like it's not lasting as long this time around. And I feel like I want to add a little bit more on my crow's feet area because whenever I smile, there's more wrinkles.
Lines. And whenever you were saying that it didn't last as long, how many weeks did it last?
I want to say I got maybe 2 months out of it, and normally I can get about 3 or 4.
Okay, so you got 8 weeks instead of 12. Have you tried supplementing with zinc?
I haven't.
Okay, so maybe trying adding zinc 50 milligrams at night would be an option. And then we might want to try a different brand. We can see what we used before. And then the other thing that we might need is a little bit of an increase in dose. We can definitely increase your dose in your crow's feet, but we have been using a little bit of a lower dose here. So we might want to bump that up a little bit to get you more duration. And then we can also consider adding a little bit of an enzyme to the Botox to help it diffuse a little bit better. A little secret technique that I learned recently, and we can see if that helps with diffusion into the muscle belly as well to help with duration. Okay, brings you to my chair.
I feel like I have a double chin in a lot of pictures that I take, and I don't like it.
Are you going like this a lot, or do you feel like are you doing a lot of looking down throughout the day?
Maybe, probably looking down.
Okay. Let's have you turn that way just a little bit so I can see. What we're looking for is the difference between subcutaneous fat and skin laxity. It looks like you have a little bit of a combination of both, but your primary is going to be skin laxity. So unfortunately, fat dissolving mechanisms like Kybella PCDC are going to make the skin laxity worse. While the volume is better, it's going to look worse to you because the skin is more lax. The best modality would be something that primarily tightens the skin. That would be Skin Tight by Sciton or RF microneedling. If you wanted to have something as a bridge between non-surgical and surgical, there's also a procedure called Renuvion that I can give you more information about. And then one of my favorite treatments that gives you instant gratification is neck band talks.
I have some concerns with my hips, and I feel like it's gotten worse since I've been working out. I've lost a little bit of weight, and I feel like because I'm more athletic now and I'm working out more, that I have some dips right here. So.
Which I love hip dips, but let's take a look and see.
You want me to turn this way?
That's perfect. We have good volume in the back, but you feel like it kind of drops off here?
Yes.
Okay, perfect. So what I would do for that, you can have a seat, is probably a combination of filler and biostimulators. I like to mix them together because we get that collagen and elastin stimulation that improves the skin quality, and we get the duration, but then we also get instant gratification from hyaluronic acid fillers. I feel like they play really well together. I would say we would probably start with 4 to 5 syringes per side, and then we would see you back in a couple of months and address more volume if we want to add more at that time.
Okay.
What brings you to my chair?
So I suffered a severe fall on Wednesday, and I want no scar. I know you can't guarantee me that.
Yes, but we can minimize the scar. Number one is going to be applying sunscreen and leaving some type of bandage on the area anytime you're out in the sun for 1 full year. And I know that's challenging. If you have any type of scar, it's never going to be 100% gone. There's always going to be some type of mark in the tissue, but we can do things to minimize it. So that's going to be the sunscreen during the day, and then some type of silicone gel sheeting to get a little bit of compression. And then once it's fully healed, which is usually at that 3 to 4 week point, you can start doing gentle massage. We can also do a trial of Botox. Putting Botox in scars can actually help them heal a little bit better. So that is more of a trial type procedure. And then one of my favorite things to do is to inject your blood into the scars. So we take your plasma and we inject those growth factors, and it's perfect, just made just for your healing mechanism. And then I would also recommend the topical version of that, which is plated exosome therapy. What brings you to my chair?
Lately, my weight has been fluctuating, so I can tell that something is different about my face. I don't know exactly what it is, but I feel like it's volume loss from the weight fluctuation.
What areas are you thinking?
Definitely like my lower face and then above my brow up here.
Have you ever had volume placed in those areas before?
I have.
Do you know what type of product, if it was filler, if it was a biostimulator?
It was a biostimulator.
And what type of result did you get with that?
I got great results with it.
Maybe it's just time to do it again.
Just keep it up.
Keep it up. I would say we could use 1 vial per side for this area. We call that the submalar area, which just means it's under the cheek. We would revolumize this just enough to give you volume back, but not to make your face look wider. Right? And then in your temple area, same thing. You would probably need 1/2 to 1 per side. And then we would repeat that treatment in 8 to 12 weeks. And that's going to not only replace volume, but it also makes your skin glow. So you get that dual benefit. And then I would also recommend doing Skin Aid, which is going to be an oral collagen drink, doing that every day, because that will help the biostimulators work even better.
Great. Cool.
I feel like I just look tired, and I feel that I'm not tired, but I look tired.
And whenever you are saying you look tired, is it going to be more in the morning or at night, or just like all the time you're seeing that?
I feel like consistently throughout the day, concealer used to cover darkness, but now it's like actual lines. And in photos, that's the first thing I want to Photoshop.
Okay.
I just feel like my lines pull further.
So it's some hollowing, like the darkness and the skin itself. What that means is we need a little bit of volume restoration and we need some skin quality improvement. So it's going to be dual modality. Most of the things we do are dual modality. That would be PDGF or PRF gel or dermal filler injected under the eyes in combination with energy-based treatments like Moxie or CO2 laser, and then with a microdose of Tox along the area, and then topical at home. I would recommend the growth factor, the plated under eye, and all of those things combined together are going to give you the best results. That would be our eye reset.
Oh, I'd love that.
What brings you to my chair?
I've noticed that as I'm getting older, I'm getting a little bit thinner up top, especially in the part and my cowlick, and I want to discuss my options for that.
And what have you tried?
Minoxidil?
Minoxidil? Yep.
And that's it.
And I don't know if you know this, but there is a female and a male minoxidil, and the male is twice as strong and it's less expensive. So I just tell my female patients to use the male version. It's one of those pink text things. Have you ever heard that term? That's one thing that you can do. And then one of my favorite things is drawing your blood and taking your plasma and injecting it into the scalp, and then also microneedling it. We do have a package that includes 4 of those sessions. And then we also have something called plated hair, and you apply that to your scalp every day. And so it's like getting the blood injection procedure at home every day, and those synergistically work together. And then the other thing that we add to it is the Skin Aid drink, because that also has vitamins in it to help with your hair growth. Perfect. I'm in my own chair because I'm also noticing some age-related changes, primarily in my neck area, and I'm noticing it in the mirror in photos, and it's really kind of starting to bug me. And I have done platysmal Tox for a long time, and I love it. It's almost like that bra support to my neck, but I am now going to start doing hyperdilate radius in my neck. I've never done that before, and I do want to do some microneedling, and then I am also considering that bridge like I was talking about between surgery and non-surgery, which is Renuvian, which is a treatment that uses an instrument that goes inside the tissue and heats. I'm going to try the hyperdilate radius first with the microneedling, and then give that about 6 months, and I'll go from there.